And we are live. It's Dr. J in the house with Evan Brand. Today, we're going to be talking about the 5 hidden parasite symptoms that we see clinically that most doctors miss. We're going to dive into this topic today. Evan, how are you doing today, man?
Doing good. I can't complain. I had parasites years ago. Y'all probably heard my story on that. I had Giardia and crypto. I lost 30 pounds without trying. I had just random bouts of anxiety. My
Mhm.
skin wasn't good. So, yeah, I've had personal experience and we've both had a ton of clinical experience with this stuff.
What were the big parasites that you had? Let's just kind of talk about our own personal experiences with gut stuff and parasites first. What were the big ones you had? I remember it was the three amigos, but go ahead.
I had Giardia and crypto. And then along with that, H. pylori. So technically 2 parasites, 1 bacteria. And yeah, I had a lot of issues, a lot of weight loss that was uncontrollable, and I didn't know what the heck was going on.
Yeah. Nope. And so we had what? Crypto, you said Giardia and H. pylori, right? What were some of the big symptoms that you had personally had?
The weight loss was big,
Yep.
skin, mood, sleep. I mean, it was all disrupted.
And I remember also too, there was some blood sugar stuff. You were getting dizzy and lightheaded after meals, right? Those are some kind
Yeah.
of uncommon symptoms, but they happen, right?
Yeah, well, I mean, I had mold, I had Lyme, so once you pile up the functional medicine issues, it can start to get confusing. And this is why it's important to get the data so you can tease apart what's actually going wrong and not just guess. Because a lot of people are doing parasite cleanses and they have no idea what they're up against. And they're not even testing, they're just buying some random TikTok cleanse and then they wonder why they feel bad and then they stop taking it. It's this whole thing now.
And here's the big thing that I see functional medicine wise, right? And this is what you learn with thousands of patients' experience. And this is what you're not going to get this from ChatGPT. You're not going to get this from like what you kind of the general parasite cleanse online. When you have gut infections and gut microbes, you more than likely have an array of different things. It's very rarely just one thing. The biggest assumption most patients make is they think it's just one thing. If they just get this thing, everything unlocks. It's typically not that simple. When someone who has a very acute issue, right? Maybe it can be that simple. But the most people that we see, there's a more of a chronic health implication with everything going on. There's usually a lot of things happening. So maybe there's some gut stuff, maybe there's some mental health stuff, brain fog, anxiety, depression, energy, focus issues, lethargy. And there may be some IBS symptoms too, right? Bloating, gas, constipation, motility support. And a lot of times when you come in and you just start blasting microbes out in the gut, a lot of times you can feel worse because you've not set the underlying milieu, especially if the hormones have been beaten up for a while. Hormones are a really important trigger to help your body become anabolic, to heal and recover. And so just going in and blowing stuff up, you still don't have this anabolic environment where your immune system's healthy, where you're absorbing nutrients, where your gut lining integrity is good, where you have a lot of nutrient density over the last months and years. And so then it's like you drop bombs, but then you can't get the carpenters in to help work on healing and repairing.
Yeah. Yeah. This is a common story. I'd say out of every 100 people we test, we'll probably see half or so have parasites. I think it
Mhm.
depends on the year. And truthfully, it depends on our content. I mean, sometimes if we're talking more about parasites, we get a surge of parasite clients that have already failed with other providers. And so I would just say in general, it's more common than you think. And you do not have to leave United States to get parasites. This idea that you have to travel to a tropical country, it's not true. Look at your pineapple from Costa Rica. Look at your blueberries from another country. Look at your meat from another country. Your grass fed meat at Whole Foods, they're shipping it in from Argentina. It's like, okay, so the whole food supply is international these days. You do not have to be a world traveler to get parasites.
And also too, many patients, they take the functional medicine principles and the philosophies, they kind of already been failed by conventional medicines. First off, conventional medicine doesn't really acknowledge parasites being an issue. They kind of say this is a third world kind of thing, right? You see like the starving kids in Africa with the kwashiorkors kind of belly and all the diarrhea and the amoebic dysentery, right? They're like that's a third world issue. And they think, that's not really a problem here. One, they're wrong. We see it all the time. But two, you can have other gut dysfunction where it may not just be a parasite by itself, maybe a parasite with something else going on. Plus, the testing that we run some of the PCR genetic testing on the stool, and we may see parasites that are borderline, that are not even at threshold. They're not even at a high level. So let's say let's say blasto requires 10,000 cells to be considered positive. It may be at 1 or 2,000 cells. Is at a high enough level where it could be creating some problems? And the problem with conventional testing, usually it's going to have a stain on it. And then there's a microscope where you're looking at it visually. And it has to be at a high enough level to see it there, right? But with the PCR, we can test a little bit more in a sensitive manner. But we'll see people that have blasto at a lower level, maybe not positive, or Giardia at a lower level, not positive. So now, how does that person get picked up by conventional medicine? They don't. They fall through the cracks. But now, what if it's very low, and then now they have SIBO or high levels of Citrobacter or Pseudomonas or Morganella? Maybe they have Candida, NH. pylori. Maybe they have a lot of gut inflammation. Their caloprotectin's really high. Maybe their immunoglobulin A is either very high or very low. So their immune system's overly stressed or overly depleted. And maybe they have low elastase, so low enzymes, low acids. Maybe that's also creating a biliary insufficiency, not enough bile, so they're not emulsifying, breaking down their fat. And then here we are. And so you can't just drop a bomb and all the other collateral damage just reverses. And so that's the biggest mistake most people make coming in. They just take the conventional medicine philosophy and they apply a functional medicine intervention. So here's the one-off thing. Instead of doing this thing conventional medicine wise, now we're going to do this thing functional medicine wise, and we just think it's all going to heal. And not that simple.
Yeah. Yeah. Well said. Let's pull up a GI real quick if we're gonna uh, talk about the biomarkers. This case here, I just wanted to show off page 4 because you're bringing up a lot of important stuff on the intestinal health side, which is
Yep.
what is the collateral damage based on the infection load? And you can see here, this guy had low pancreatic elastase. Look at the occult blood at a 63. This is horrible. Gut inflammation, calprotectin's a 997. That's terrifying.
Holy smokes.
I know, I know. This looks like to me an autoimmune issue, ulcerative colitis or Crohn's probably due to this.
100%.
Yeah, I mean, look at this activation protein we've got here too. So the gut is clearly under attack. And what can happen with these infection loads is they will create this runaway train effect with your gut inflammation. So I just encourage you, if you're getting put on some sort of an inflammatory modulating or immune modulating, like immune suppressant medication, you got to be careful with that stuff because you're not fixing these bugs. If you fix these bugs, that's what's actually going on. And the inflammation will get lower by clearing the bugs. But this idea of getting put on these chemo drugs and some other stuff, I've seen some scary conventional protocols.
All right. So let me just pull up a couple things I want to highlight here for y'all listening at home. These are a couple things that we see here, right? So some big symptoms that we see, the 5 big symptoms we see other doctors just miss. It's very, very frequent. But number 1, we're going to see brain fog. That's a common one. And this is big because when you have brain fog or anxiety, now who are you seeing if you're in the conventional medical system? Now you're seeing a therapist. Now you're seeing a psychologist or a psychiatrist. And then now what? So now your chance of being put on other drugs that mask those symptoms that don't get to the root cause goes up. And I tell patients all the time, I'm not anti-conventional medicine or anti-drug. I'm pro root cause. And so walk me through how we're getting to the root cause. Most of the time when we go conventional medicine, we're not. Fatigue. So, of course, other nutrient deficiencies, whether it's vitamin C, whether it's B vitamin issues, whether it's things that impact the mitochondria, nutrients that plug into the thyroid, nutrients that plug into the adrenals, important cofactors and enzymes to help make our female or male hormones. And of course, skin stuff. People think about skin and they go to the conventional dermatologist. They're given retinol or retinoids or tretinoin, Accutane, tetracycline, clindamycin, different, all these different topical things, and Metrogel, and they're not really fixing the underlying issue. Comments on
Yeah.
that, Evan?
Yeah. Well, it's just they're looking for a quick fix. And unfortunately, this thing takes potentially months to clear up. And
Yeah.
the other variable is if you have mold, you can also develop somewhat of an immune suppressant effect from the mold, the mycotoxins. And I think you're going to be more susceptible to picking up bugs. That was my story as well. So I find that if people just do parasite cleanses, they don't dig deeper into the immunity, then they're going to continue to spin their wheels.
110%. Now, a couple things here, right? My lab tests normal. I feel off, right? These are big questions. Why do I have these symptoms? No one can explain it. Right? Why do my gut issues keep coming back? And a lot of times there's something else going on. This is kind of cool because it really gives you that impact of how these parasites, they kind of adhere into that gut lining. They kind of stick. That's kind of how they hang out, right? They attach to the intestinal tract. They activate a lot of the immune cells. So now we're having histamine. Now we're having neutrophil activation, eosinophil activation, right? Eosinophils, we'll see those go high on a CBC, right? Eosinophils, EEE for allergies or parasites. And people are like, well, I have mast cell activation syndrome, right? MCAS. And it's like, well, what's the root cause of why your mast cells are in overdrive? Why is your immune cells overstimulated? Because MCAS, a lot of times, for instance, doesn't speak to what the root cause is. Is it a mold issue? Is it a combination of food allergens? Did you have a bunch of glyphosate exposure over many years that it wiped out your gut lining? Is your gut really permeable and you have lots of food allergens? Do you have infections? And so we have to speak to the underlying issue. And many people, when they're describing their issues or their symptoms, they're speaking about things that are downstream, not upstream.
Yep.
So big thing out of the gate, right? IBS, bloating, food sensitivities, fatigue, brain stuff, anxiety. That's going to be number one. Next one, we have our nutrient theft. Okay. Big things you want to highlight when we have suppressed appetite, diarrhea, or let's say we just have malabsorption. Let's say we're not breaking things down as well. That's going to make it harder to absorb our protein, absorb our fat. Now we have inflammation. So, like that last person you showed on the GI map, they had lots of eosinophilic protein, EPX. They had lots of calprotectin. You could easily see anemias, whether it's a megaloblastic anemia where your red blood cells and your hemoglobin go big, and that's a B vitamin issue, typically B12, folate, and B6. Or it could be more of a microcytic hypochromic anemia, which is more iron. These are pretty darn common. Comments on that?
Yeah, hair loss too. So, ladies, you're going to blame your hormones, or your hairdresser's going to say, hey, maybe you need to do this or that. But if you improve your gut, your hair will magically start to grow. My wife gets compliments on her hair all the time. People are like,
Yeah,
how
her
the
hair
heck
is so
is,
long. It's crazy.
yeah, people are like, how is that not hair extensions? And I would credit working on her gut and then also
Yep.
organs. I think the organ
Yep.
capsules have really helped.
Well, organs are just notoriously high in copper, which is really good for the hair, zinc, which is really good for the hair. Of course, you need iron and B vitamins, biotin, B7, really important for the hair. Anytime I see chronic hair loss, outside of just looking at androgenic alopecia, which can be a big thing, elevated DHT and that alpha reductase enzyme in men, or perimenopause, menopause, low progesterone, low estrogen in women, the gut plays such a big role in hair. You have to get the protein in there, right? Your hair is mostly keratin, protein. You need those building blocks.
Yeah.
All right. Next is overactive immune system. So we see lots of patients have one, they have gut permeability, leaky gut. They have the enterocytes kind of opening up, if you will. And those opened up enterocytes, well, we have these toll-like receptor sites. These are the Centurion guard. They sit guard in front of these enterocytes, and they're constantly sensing the environment, whether it's viruses or bacteria or lipopolysaccharide or food allergens, and they're going to sense and provide the input to that zonulin protein to go up or down. And when that zonulin protein goes up, that's going to unzip that tight junction, those enterocytes, and allow those different microbes or food in. And that's going to overactivate the immune system. And you can see what happens, right? We have our CD4, our helper cells over here. We have our different interleukins. Here's our eosinophils. Here's our basophils. Remember, our basophils are become mast cells in the tissue. And what do mast cells produce? Histamine. So someone's saying, I got histamine problems. I got mast cell activation syndrome, right? It's like, well, yeah, so that's downstream. Let's go upstream to what the actual trigger is. You can see all these different interleukins and everything. And that lamina propria, that's just that first lining in the small intestine right there. And then you could see all the mucin, things like Akkermansia help with this. And then you could see these different microbes. These are helminths, for instance, type of worm. And that's actually causing tissue damage and allowing that gut permeability to happen. And so we'll see more eosinophils. We'll have this more Th2 immune response, Th1, Th2. Th1's the cytotoxic immune response. That's your natural killer cells, which are your CD8, your helper cells, CD4, right? Think of these as the frontline special forces of your immune system. And then you have your Th2, which are going to be your antibodies that are the infantry that come after the fact. And this is going to be your Th2. You'll have more histamine release. And this, we can also see more skin rashes, itching. We're going to see more sinus congestion and maybe even more allergy-like symptoms out of the gate.
Yeah. So, this is why we'll factor in some herbal natural histamine supports into the protocol, because you're basically you're basically on fire, if you will, from an immune perspective, and you're going to
Correct.
overreact to everything. So that could be more food sensitivities, like you're going to react to higher histamine foods such as
Hmm.
avocado. It could be you're overreacting to peppers, tomatoes. So a lot of people need to go on a low histamine diet while we're working on the gut to improve their health. So I don't think it's forever, but I think for a month you should try to go low histamine, see how much better you feel, and then we'll come in with some natural histamine supports, try to stabilize the mast cells while we're clearing out the bugs. That's generally what we have to do.
100%. All right, so big things out of the gate I want to highlight now. Gut-brain axis. This is a big deal here. This is big. I want to zoom in on this if you don't mind. So out of the gate, we have our brain, we have our spinal cord. This is part of our central nervous system. And then we have our autonomic nervous system. And then part of that is parasympathetic, sympathetic. And then autonomic, the parasympathetic comes down via the brainstem. This is the vagus nerve here. So this is the spinal cord, but you have this vagus nerve. You don't really see it, but it comes through and it wanders throughout the whole organs, right? Vagus literally translates to wanderer. And so you can see you have this HPA axis kind of feedback loop. So our pituitary hypothalamus here, hypothalamus pituitary, that feedback loop via cortisol, corticotropic releasing hormone, then adrenocorticotropic. Now we're at the adrenals, and then it goes cortisol next, and that impacts the circulatory system. It's going to impact, it's going to be impacted by bacteria, cytokines, different microbial issues, food allergens, parasites. This is going to cause a cortisol response. And so the more cortisol you have over time, it actually can weaken the gut lining. So a chronic cortisol stress response, this HPA axis goes into overdrive, and it can also impact that lamina propria that we showed, that first gut lining layer, and it can actually make the gut go a lot more thin.
Yeah, and this is more common in the modern day when you have microplastics and pesticides and
Mhm.
other things that are damaging the gut. So maybe in historical times we would have been able to coexist, have some level of parasitic infection and be fine. But I think with the modern world's toxicity that it presents, we just have too much in our buckets to handle this anymore. So people ask, well, parasites have been around forever. Why does it matter now? And my answer to that is, well, we have a lot more on our plates. We have a lot more on our immune system that we didn't have even just a couple hundred years ago.
Yeah, and also people would pass away all the time before antibiotics were created, man. People would pass away all the time. Obviously, we know the key with parasites is clean food and water. Like don't poop and pee where you live and make sure you have clean water source. So that fixes like, the Geyer studies, right? Geyer is a public health epidemiologist, researcher, and he found that 70 to 80% of our health is just coming from clean water, clean food, having good, sewage and sanitation practices fixes most of the problems. Now, there's a feedback loop here, right? Look at this. You have efferent nerve input and afferent nerve input. Afferent means essentially afferent is going to be nerve input back from the intestine back to the brain. So it's like it's the sensor telling you what the temperature is, and then you can see the temperature. And then the efferent is going to be the nerve input that carries out what the brain wants it to do. So brain to the organ is going to be efferent. Afferent's going back up, back up. It's telling it where it's at. And so you can see all the different inflammation here, T cells, B cells. Again, we just say inflammation overdrive based on the immune system. That's what's happening here.
Yeah. And
And
that's
then
why
let's
you're
just kind
looking
of
at
talk.
page 4. So page 4 of your GI, when you get this done, this is why we
Hmm.
want you all to test, not guess with your health, is because when you get a GI panel, you're going to see the calprotectin level. And so this is just helping you to understand some of the geekiness behind it. But what you need to know is the number of your calprotectin. Even conventional GI
Yes,
doctors recognize calprotectin as a marker. They just use drugs to suppress the inflammation rather than clear the infection. Now they can use, we didn't talk about this, but they can use conventional drugs to kill parasites, and they can be very effective. But I have a bias towards the natural stuff.
100%. Now, out of the gate, you're going to see here neuroinflammation. This plays a big role because, like, one of the big symptoms that your doctor may miss is inflammation in the brain, right? Inflammation in the brain is a big deal because you're going to come in with anxiety, depression, brain fog, cognitive issues. You're going to be complaining. And if you have a gut issue, your GI doctor is not going to recognize any of this as being connected to the gut. And that's a big deal. And of course, the more cortisol we have, right, the more that impacts the blood brain barrier. When that blood brain barrier, this is known as astrocytes, when those astrocytes are depleted, it's going to allow microglial activation. So now we have the inflammation in the immune system is overreacting now to inflammation due to that blood brain barrier being depleted. And so when those microglial cells are activated, it's going to show up as brain fog and mood issues. And we really just have to get to the reason why this blood brain barrier is permeable. And it starts in the gut, right? Get this intestinal inflammation better. It's going to help because inflammation is bidirectional. That means inflammation in the brain, right? Or in the body, stress in the body can impact the gut. We know that because if you have trauma or if you get stressed, we know your digestion gets crummy. But inflammation here with different microbes can also allow inflammation to come out and then impact the blood brain barrier and then create all these other symptoms.
Yeah, I had it. I went through it. So I can tell you with confidence your mood will get better. And, there's people on antidepressants right now, anti anxiety medication that have some level of dysbiosis, which could include parasites, bacteria, fungal infections, yeast. And if they clear that up, their mood issues will completely go away, which
Yep.
the pharmaceutical industrial complex would like you to be a lifelong customer of an SSRI, SNRI, and these other meds. But I just prefer to fix the gut and watch the mood heal. And you can save your marriage with this stuff. I mean,
Yep.
truthfully.
I wanted to highlight one thing here. This one, sleep disturbances. Parasites have opposite wake and sleep cycles than we do. And so they may be up and more active at nighttime, and that can create more inflammation. And guess what happens when you create more inflammation? What's happening to your adrenals and your cortisol rhythm? It may be going up at night. And if your cortisol is going up at night a little bit or it's disrupted, guess what that can do to your wake? It can make your sleep less restorative. It can impact your HRV and your readiness scores, but it could also just wake you up because it's overstimulating you. That cortisol response is creating a bunch of adrenaline and blood sugar, and you're getting mobilized and you're feeling alert. And it could be from a parasite issue. It's definitely possible.
Yeah.
Comments on that?
Well, I think with the herbal antiparasitics, most people can resolve this in a few months. So, just to give you a timeline, I have
Hmm.
seen some cases that take 6 months, but I would say in general, plan for 3 months to really start to clear this out. And there's different herbs that we use for different bugs. So, most people have heard of oregano oil, which can be broad spectrum. It can be
Hmm.
pretty hot, meaning I don't like to use it if there's a lot of gut inflammation happening, but there's a
Right.
bunch of others that we can rotate through. I think the ultimate answer for people, maybe if you're glazing over some of this stuff, if it gets too geeky for you, here's what you need to know. You need to know that you can get the GI panel done at your home. You can get the results in 2 to 3 weeks to figure this out because you may be resonating with some of these symptoms and thinking, okay, do I have this or not? It's easy. One stool sample will give you the answer. And then, depending on what shows up, we're going to help you through designing a protocol. But oregano oil's not all inclusive. Like that is not a full protocol. And just doing oregano or just doing garlic, for example, I don't want to say you're destined to fail, but I don't think you're fully going to resolve your issue.
100%. And then last thing here, just want to move on is blood sugar. So the more cortisol and stress you have, the more that can increase glucose, right? The more stress and inflammation you have, you're actually mobilizing about 25 to 30 grams of glucose. Think of that as a Snickers bar. So the more stressed and inflamed you are, each time that happens, you're going to be getting a lot more glucose, like a Snickers bar equivalent, which people don't realize that. And then let me just kind of hit a couple things here. We have two main types of parasites. We have our helminths. These are our parasitic worms. These are multicellular. And then we have our single cellular. These are going to be like our protozoa. And so here are the ones. So helminths, parasitic worms. These are multicellular. Roundworms, pinworms, hookworms, whipworms, threadworms, right? Ascarius lumbricoides, Enterobius formicularis, Ancyclostoma duodenale, Trichuria strichuria, Strongyloides stercalis, right? These are our large multicellular worms. And we'll go into the meds real quick. And then our protozoa, these are our single cell ones, okay? This is going to be Giardia. This is going to be E. histo, right? Trophozoite. These are going to be D. fragilis, crypto, blasto, right? These are very common in modern PCR testing. And then one thing I get is like, oh, I'll just do an ivermectin cleanse. Well, number one, ivermectin works more on these helminths, though, right? And it works primarily on Strongyloides, so the threadworm. So that's the one that's going to work the most on this guy right here, Strongyloides. People think, oh, I'll just do an ivermectin cleanse. Well, it doesn't do well on whipworm. It doesn't do well on pinworm, and then a little bit on roundworm. And so if you combine it, ivermectin with usually a mebendazole tends to be the best combination. But again, see these parasite cleanses, guys, that's only working on helminths. Right? That's not touching these protozoa that are single cell. So just be mindful of that. People, I've been seeing lots of stuff. Oh, I'm gonna do a parasite cleanse. It's these two medications. You got to combine them, but it's not touching these, and it's not going to touch SIBO. It's not going to touch H. pylori, Candida, or fix all the gut inflammation. So just be mindful of that.
Yeah, it's kind of trendy, right? It's
Yep.
becoming trendy. You're seeing states now. I think Florida actually just passed. We should be getting some over the counter ivermectin soon. So, I think this is just driving more interest in it. But I would agree that you
Hmm.
definitely want to have the natural stuff on hand as well. So
Yep.
ivermectin, I mean, we could do a whole thing on the chemistry behind it. It came from a group called avermectins, and some of it was derived from the soil. So in a way, it
Yep.
is natural, but I still think the true herbals, the clove, the berberines, there's a lot of different tools that we use depending on what you show up with. Because once again, we've alluded to this some today, but it's very rare to have just a parasitic issue. Most of the time, you're going to have bacteria or yeast with it.
Correct. And how these medications work, albendazole, mebendazole, microtubule formation. So it blocks the parasite uptaking glucose. And there's some other diseases that begin with a C and end with an R that have also shown to be very helpful with these conditions because it's blocking uptake of glucose. And it's supposedly other types of conditions that start with a C and with an R also uptake glucose. And these medications actually help in that way too, which is kind of interesting.
Yeah,
And then same here, right? Ivermectin was a big thing a couple of years ago, right? Because it has a immune supporting antiviral impacts, but it causes neuromuscular paralysis. It basically opens up the parasite chloride channels and it overwhelms it. It also has zinc ionophore qualities as well. So that's how that's working. And then we have some of the herbs that we use, right? We're using artemisia, we're doing black walnut, we're doing neem, we're doing oregano, we're doing different berberines. We do a lot more other herbs besides this, artemisia, wormwood. But again, we also have to make sure we support the microbiome, fix the overall function. Just killing alone, the dose, and it's also a combination and a synergy of a lot of these herbs together.
that's right.
Any
That's right.
comments on that, Evan?
Yeah, 1 plus 1 sometimes equals 3 when it comes to these blends
Yes.
because of the different alkaloids and terpenes. And so sometimes you'll take just oregano and it doesn't work, or maybe it's too strong for you. So I just encourage you
Yeah.
get the data and don't just bomb your gut.
Yeah, and symptoms may be mild. You may have fatigue or brain fog. They may be chronic and subtle, and your gastro may miss it because it's not the typical chronic diarrhea. And so you got to think a lot deeper about it. You can't just think that you have it. So, guys, if you're enjoying this podcast, right, feel free to share with family and friends. Parasites aren't just the typical digestive issues that you know bloating, gas, constipation, diarrhea. It can be deeper. Some of your chronic health issues that we mentioned here today, cognitive, mood, hair, skin, nails can all be connected. Sleep can all be connected to it. So, you definitely want to not guess. You want to assess. You want to figure out what's going on with you. Take a look at evanbrand.com for Evan. Evan sees patients worldwide. Myself, Dr. J, justinhealth.com. We've been doing this in the trenches 15 years, 5,000 plus patient experience between each of us, a lot of experience. So if you need that support, try stuff on your own. We put lots of free content out. 99% of the patients we reach, people we reach with our content will never see us or meet us or work with us. And so we're helping more people than we are clinically. But if you want to be in that top 1%, take that next step, we're here for you. Links and information down below. Anything else, Evan?
Yeah, well said. And that's true. I mean, a lot of the stuff we give you here can change your life. So hopefully you'll implement some of it, but more importantly, you'll get the drive and you'll get the motivation to know that there is a higher level to this game of life. And by improving digestion, you improve your mood, you improve your hair, your sleep. This is all about being a better version of you. So, yes, it's important to catch the symptoms like, oh, my gut hurts. But ultimately, once you fix that, you're clearing the path to a higher level of living. So, I just
Yep.
encourage you to know like, I was in the depths of hell at some points with my
Yep.
symptoms. And to come out of that, it makes you extremely grateful for every day. And just know that as you feel better, your gratitude, your happiness, all that stuff can be directly linked to clearing this stuff. So if you beat yourself up, you think that it's just like a personality defect or something you have. It's probably not. It's probably something like this.
Yeah, no, I'll come back and do another podcast or a video kind of on some of these topics. So if people want to come in with a live Q&A, I'll be there for y'all. But yeah, can parasites cause anxiety? Yes. Can they cause neurological issues like ear ringing? Yes. Anytime you create immune activation or you impact the gut, that impacts electrolyte absorption, nutrient absorption. It impacts your adrenals, your thyroid. And so it has collateral damage downstream where it's not like the direct thing, but the damage it causes upstream can trickle downstream to other nutrients, other problems, and those symptoms can manifest downstream for sure.
Yep. Well said.
So, excellent podcast here. You guys, if you enjoy it, like, thumbs up, comments down below, and we're here for you for additional support. Let our staff and team know. Links down below. All right, guys, have an awesome day. Evan, peace out, brother.
Take care.
You too. Bye.